Vida's medical program is an outreach to communities. We basically go to impoverished communities in the 3 Latin American countries we work in and help out the people who are less fortunate than us, that do not have access to health care, that are in desperate need of attention, of medical health care, of medications. We have volunteers that have come throughout the years to help communities and make a difference in the world just by helping others and by bringing healthcare to populations that need it the most. The most common diseases or illnesses that we encounter in clinics are respiratory infections, either upper respiratory or lower respiratory, diarrhea, parasitical infections, anemias, and a lot of skin conditions as well. The communities we work in normally have a lack of running water, or they use outhouses for toilets, which means that they basically live in conditions that are not adequate in general and don't give the proper hygiene. This is why we still have a lot of communicable diseases in a lot of Latin American countries, especially in the most impoverished communities. This is really broad learning experience for volunteers. I guess the main experience that the volunteers gain is this: the interaction with the bilingual professionals who will teach them and give them knowledge and experience that we've learned through for years. And they get to soak it all up in 5-6 days and learn a lot in those 6 days. They basically come out knowing 10 times more than they came in. You see a side of countries that you would normally not see. And also, one of the key takeaways for me is the actual interaction with the professionals, to encourage you or disencourage you to follow a path. Basically, when I think of Vida, I think of education, I think of guidance, career path orientation, quality of healthcare, reaching out, helping people, and those are the key points to this experience.
Hola, mi nombre es María Lucrecia José. Mi al venir es porque yo camino ahogándome de asma.
Vine a consulta porque tengo un problema de dolores de espalda y como de migraña.
Vine porque mis hijos están enfermos, ya es la única forma de lograr venir a las medicinas para ellos.
Ah, no, bien atendido y bien amable la gente que me recibieron, yo no tengo queja aquí.
Porque a veces no tenemos seguro, entonces es una gran ayuda para todos.
Lo más lindo, muy maravilloso, muy bien me atendieron las chiquillas y voy muy contento con todo eso, dándole gracias al Señor Jesús y con la ayuda de ustedes que me han atendido lo más maravilloso.
Soy muy pobre de recursos y no puedo estar comprando el medicamento. Mire que yo en el hospital he ido, me ponen hasta 7 mascarillas y yo me he llegado ya muriendo gato.
Ah, muy buenos, son muy amables, muy generosos, demasiado.
Basically, the volunteers are divided into small groups of 3 volunteers. They all have an interpreter who has been trained in medical interpretation, and we set up a pharmacy as well with basic medications. So basically what happens in the clinics is that the patient comes into the groups, the patients are interviewed by the volunteers with the help of the interpreter, of course, and as they're being interviewed by the volunteers, they are retrieving information that is important and relevant to whatever clinical diagnosis we're going to do later. After the volunteers have interviewed, they take the patient's vital signs and then they call the doctor and review the patient with the doctor. They present the case as you would normally do in any case presentation, with patient's name and full information, and once they've gone through all the information in the intake form we have, they go through the vital signs with the doctor and the case discussion starts. We start encouraging volunteers to think a bit more beyond what they've already learned in school and start thinking of possible diagnosis, differential diagnosis, and when possible give us treatment plans or recommendations. Of course, everything is under the direct, strict supervision of medical doctors licensed in the countries we work in, and of course they're all bilingual. And after the patient has been seen by the physician, we write the prescriptions. The patient is given educational recommendations, lifestyle changes recommendations. Medication is retrieved for the patient and handed out to them. Normally, healthcare in impoverished countries is just basically taking care of 1 or 2 priority diseases and then sending them home without giving education to the patient, without insisting on lifestyle changes. In Vida, I always tell the volunteers that we need to change the world 1 patient at a time, and this is what Vida does. We are starting to change the world 1 patient at a time. We take our time with each patient. Each consultation is not another number on our list. It is a patient, a person, someone who will receive medical care, someone who will receive medications, but who will also feel the human warmth and the quality of healthcare that is given to them. Anyone can join the program, really. Anyone who has the will of service, will to come and help others, to take time from their lives, from their schedules, and just visit a different country and come and serve and help all those who are in need of this help. The best program ever, simply because the professionals and the volunteers in the program, we all care about what we're doing. This is not a spring break trip for everyone. For us, it's commitment. It's love for what we do. It's coming out and helping those who need it the most, and making a trip fun and all, but it's mainly helping and educating and, again, changing the world 1 patient at a time.